We are here today to address the topic of food security and nutrition programs in Africa. As I think many of you know, I'm the sponsor of the Global Food Security Act of 2015. A bill in its prior iteration passed the House. Unfortunately, didn't gain support in the Senate, although we're hopeful that that is something that will happen in the near future. The Global Food Security Act, H.R. 1567, will help provide a long-term strategy to combat global hunger by authorizing the existing National Food Security Initiative coordinated by USAID, commonly known as Feed the Future. It is a bill with broad bipartisan support, including the original co-sponsorship of my friend and colleague, our ranking member Karen Bass, who will be here momentarily, as well as Foreign Affairs Committee Chairman Ed Royce and ranking member Elliot Engel. I am very happy and will be joined shortly by the Chief Democratic co-sponsor, Betty McCollum, with whom we've worked very closely on this legislation. I want to thank Betty, as well as her dedicated staffer, Jen Holcomb, for their hard work and dedication in promoting food security. This is truly a bipartisan collaboration that will result in enactment sooner rather than later of this legislation. I also want to acknowledge that other subcommittee members have joined us as co-sponsors: Mark Meadows, Dr. Scott DeJarlis, and David Cicilline. Investing in global food security is a policy that is both penny-wise and pound-wise. This program strengthens nutrition, especially for children, during the critical first 1,000-day window from conception to the child's second birthday. Indeed, there is perhaps no wiser investment that we could make in the human person than to concentrate on ensuring that sufficient nutrition and health assistance is given during that first 1,000 days of life. 1,000 days that begins with conception, continues through pregnancy, includes the milestone of birth, and then finishes at roughly the second birthday of that child. Children who do not receive adequate nutrition in utero are more likely to experience lifelong cognitive and physical deficiencies, such as stunting. UNICEF estimates that 1 in 4 children worldwide is stunted due to lack of adequate nutrition. By addressing nutrition during the first 1,000 days of life, we can help lay the groundwork for the next 25 or 30,000 days of life, or whatever number that our Creator has allotted and that are filled with good health and a good, strong immune system and all the other positives that accrue from that investment. As our three witnesses will attest today, enhancing food security is also transformational in the lives of millions of smallholder farmers throughout the world, particularly women. Feed the Future teaches small-scale farmers techniques to increase agricultural yield, thereby helping nations achieve food security, something that is in the national security interest of the United States. And of course, we are our brothers and sisters' keepers, and it's important that we be backing this and having their backs and ensuring that this becomes a reality. It is also economical in the long run, and should lead to a reduction in the need for emergency food aid. The approach we have taken in the Global Food Security Act is fiscally disciplined, authorizing an amount for 2016. USAID, nevertheless, can do more with less by leveraging our aid with that of other countries, the private sector, NGOs, and especially faith-based organizations whose great work on the ground in so many different countries impacts so many lives. And we will hear from Dr. Wu from Catholic Relief Services momentarily of the good work that their organization and other like-minded groups do throughout the world. By statutorily authorizing this existing program, which had its roots in the Bush administration and was formalized by President Obama, we are also increasing our oversight by requiring the administration to report to Congress. Political will is absolutely essential in enacting a global food security policy that will continue and hopefully expand. It is one thing that I hope this hearing will bring to light, that such interventions in the lives of so many people in Africa, particularly in the first 1,000 days of life, are not only cost-effective, but morally imperative. Without objection, I'll be adding testimony from Kimberly Flowers, who's director of the Global Food Security Project for CSIS, and she points out in her testimony that Tanzania has received more Feed the Future funding than any other focus country in the world. And then she just pours it on with what has actually happened. In 2014 alone, she points out, Feed the Future supported farmers increased the value of their agricultural sales by more than 19 million. 100,000 producers reported that they are using new technologies and management practices for the first time, significantly improving production and increasing incomes. Feed the Future leverage, she goes on, nearly $152 million in private investments in food and agriculture. During the same time, the U.S. government reached 1.4 million with nutrition services to improve maternal and child health, focusing on exclusive breastfeeding and complementary feeding, dietary diversity, and the uptake of zinc, iron, and other targeted micronutrient supplementation. A success story that obviously needs to be replicated, but Tanzania is certainly a good showcase country where it has already done quite well.